a restoration, which is exactly the same shape as the filling, but it's made from a very strong material that's very similar to tooth structure and is bonded in place, just like a white filling. Hi, I'm Flynn. I'm a general and cosmetic dentist at the Modern Dentist in Shoreditch. Today I'm going to talk about inlays and onlays and what they are. Inlays and onlays are an alternative to crowns in modern dentistry. So traditionally, when teeth became very heavily restored and when large fillings failed, dentists would generally recommend crowns in these teeth. A crown involves cutting the tooth down to a stump and then having a lab make a shell made from porcelain or from metal that wraps over the tooth. The idea being that it would protect the tooth from further damage. The problems with crowns are that, first of all, because they're quite a destructive procedure, which is the only thing that was possible in decades past. But because of that destruction, the structural integrity of what's left of the tooth is weakened. And therefore, that can ultimately lead to the entire thing failing. And this is one of the most common reasons these days why people lose their teeth and end up needing implants, because there's just so little left of the tooth structure by the time the crown fails that the tooth has to come out. So how inlays and onlays work is that they use almost the opposite technique to crowns. So where we have a very large filling, instead of drilling the tooth, what we do is remove the old filling and the old restoration. We clean up what's left of the remaining tooth structure, but we preserve everything that is healthy, that's left of the tooth. But then, instead of building up a huge filling, which is what would have happened in the past, what we do is take a digital scan of what remains of the tooth, send this to the lab, and the lab make a restoration, which is exactly the same shape as the filling, but it's made from a very strong material that's very similar to tooth structure and is bonded in place, just like a white filling. What this means then is that the restoration will actually age with the tooth because it's made from a very similar material. So over years, as the teeth get older, the restoration will age with the teeth. And therefore, it's got a much better chance of lasting for many, many years, and often a lifetime, without causing any issues that you would get with either a crown or a filling. So the procedure for inlays and onlays is much more similar to having a filling done than having a crown done, except it's done in 2 stages instead of 1. So on the first stage, we will numb you up exactly the same as if you were having a filling done, and in most cases use what's called a rubber dam, which is a barrier that we use to separate you from the tooth that we're working on, essentially. Then we remove what's left of the old filling. This can be either an old metal, mercury filling, or a large white composite filling. We remove this entirely, and it's extremely important that this is done well and that all of the remaining tooth structure is completely cleaned up. This is vital for the bonding procedure, which happens next. And then once we have that space created in the tooth, we take the digital scans, send them off to the lab, and we put a temporary restoration in place for usually 1 to 2 weeks while the lab are making your restoration. And then on the second visit, we normally don't need to numb you up this time. We will try in the new restoration, make sure that it fits perfectly, that it fits with your bite, and that it looks really good as well. That's a nice side effect of inlays and onlays. And then we bond the restoration in place, and you walk out with something that looks and feels just like a natural tooth. Because you're not numb, you can eat and drink immediately with the new tooth, and you should pretty quickly forget that there is anything there.